disorder. This is not something that was just discovered accidentally. In fact, this paper from 1972 showed that in pathology and autopsy specimens in patients with diabetes who died of cardiovascular disease but did not have a coronary event, you have this intense perivascular fibrosis and intramyocyte fibrosis and hypertrophy, and this is the diabetic inflammatory cardiomyopathy. Now, fast forward to more recent ways of looking at the heart using echo. So these are two important studies that looked at different cohorts of patients with diabetes. Now, these are patients who did not have ischemia, and they only had 5 years of type 2 diabetes. By using detailed echo with detailed assessment of diastolic function, 68% of patients had some form of LV dysfunction, either diastolic, systolic, or both. The minority had normal LV function. The other study, as you see on the right, which was a more European approach using ECG, echo, and BNP, undiagnosed heart failure was detected in 28% of diabetic patients during cardiac screening. And one of the important points to remember here is that they did not use diastology as the main entry point. It wasn't a detailed echo study. This was a more clinical ECG and echo. So if you look, you will find, and if you look hard enough, you will find even more. So what is diabetic cardiomyopathy? So for those of you who are not cardiologists and don't look at echoes a lot, I'm just going to try to simplify this from a very nice cartoon that was published by this Japanese group. Essentially, a normal heart is an elastic, functioning pump. And if you have diabetic cardiomyopathy, the wall becomes thicker, there is fibrosis and LVH. Because of the increased stiffness, the E prime, which is a marker of elasticity, reduces. So it's less elastic. As a result, because the space is constricted and there's more fibrosis, the ventricle becomes stiff, the pressure inside the heart chamber increases, and this causes dilatation of the left atrium and reduced elasticity. This is why the ejection fraction can be completely normal, but the patient still experiences shortness of breath and congestion. In addition, because of the effect on the myocardium, NT-proBNP also increases.